Hi everyone, welcome to our module on congenital and developmental anomalies of the nervous system. So in this video, we'll be covering extremely high yield topics related to the developmental anomalies of the nervous system. We'll just go based on concepts that are heavily tested. I'm happy to let you know that we have now officially collaborated with UWorld Medical. All my audience can get a flat 10% off on UWorld Medical Library subscriptions and bundled QBank plus Medical Library subscriptions using the code Varun10. Using this code gives you a flat 10% discount on their medical library, and it also helps me continue doing this series. Uh, Now, coming to understanding about this UWorld Medical Library, this is an extremely useful tool, and they come forward with a very new feature that's called as You Ask, where we just have an AI tool inbuilt in their medical library that helps us uh, give prompts and learn, ask doubts, everything related to the question we see on the QBank and also the concepts on their medical library. You can open the medical library, you can access the medical library using the link that's in the bio, and you can use the code Varun10 to get a flat 10% off. This lecture series is provided free and is open access for everyone. We don't receive any fixed funding from any kind of organization. There are no paywalls, there are no mandatory fee for watching our videos. If you find it useful and wish to support its development or wish this goes forward, we would kindly let you know that we accept donations through the link that is in the description and that's also pinned in the screen. Uh, you can pay us with any of these payment methods. Now, coming to the core timing of the development of nervous system. So this entire topic revolves around early embryology. All these defects occur within the first 4 weeks of gestation, which is when the neural tube is actually forming. This is critical because if something goes wrong this early, the defects are usually severe and irreversible. So we always need to remember that early timing is associated with severe structural defects. Neural tube defects occur due to the failure of closure of neuropores during the week 4. So the most important cause you must remember is folate deficiency. This is the number one tested cause. Folate deficiency is the most important cause of these neural tube defects. Other causes include teratogenic drugs like valproate and carbamazepine. So the normal closure of neural tube goes through different phases. Like first, the neural plate gives rise to a neural groove, then neural folds are formed, and finally there's a closed neural tube. Whenever there's failure of this neural tube to close, even by the end of the fourth week, this could lead to open neural tube defects. Most important causes includes folate deficiency and use of teratogenic drugs like valproate and carbamazepine. Adequate folate before conception and during early pregnancy significantly reduces the risk of neural tube defects. That's the reason why we prescribe folate in OPDs to the Indian patients, especially because most of them have a folate deficient diet. And also, the folate needs increase during pregnancy. Now, coming to the lab markers, this is very high yield for exams. So, in neural tube defects, alpha-fetoprotein levels are increased. So, this can be detected in the maternal serum and amniotic fluid. Now, let's try to understand why acetylcholinesterase is important. It is present only in open neural tube defects. Uh, uh, so the sensitive marker that we use for neural tube defects includes alpha-fetoprotein. So it's more sensitive. It's used for screening, whereas acetylcholinesterase is highly specific for neural tube defects, and this can be used for confirmatory testing for open neural tube defects. So if acetylcholinesterase is present, it's definitely an open neural tube defect. So now coming to anencephaly. So this occurs when the rostral or the head side of the neuropore fails to close. The forebrain and skull usually don't develop theirs. That's why the baby has an absence of forebrain and absence of skull, and also there's a characteristic frog-like appearance. Important association of anencephaly includes polyhydramnios. So why does polyhydramnios occur in a case of anencephaly is that because the fetus cannot swallow amniotic fluid because of uh, underdeveloped forebrain. Now, coming to Spina bifida occulta, this is the mildest form. There is failure of closure of the posterior vertebral arch, but there's no herniation of any kinds of contents through it. Externally, we usually see a hair tuft and a skin dimple. So, a very important thing to know about spina bifida occulta is that AFP is normal in these cases because the defect is still closed. Now coming to meningocele. So meningocele is a condition where only the meninges herniate out through the defect. There is no neural tissue involved, so neurological deficits are usually minimal or even they might be absent. This contains cerebrospinal fluid, not the neural tissue. Coming to myelomeningocele, so this is an extremely important defect. In this defect, both meninges and neural tissue herniates through the defect. So patients often have characteristic neurological deficits. This is strongly associated with Arnold Chiari to malformation and also hydrocephalus. This is a classic combination or classic pattern that is usually tested on all the kinds of USMLE exams, all these steps. So whenever there's herniation of meninges and neural tissue, you need to think about myelomeningocele. It's usually associated with Chiari to malformation and hydrocephalus. Myeloschisis is the most severe form of neural tube defect. So in this defect, there is completely exposed neural tissue. There is no covering at all. There is no meningeal covering. It is an open defect and is extremely severe. It represents the most severe form of neural tube defects. Now let's try to understand about few brain malformations. So the first thing is holoprosencephaly. So this occurs when the forebrain fails to divide into two hemispheres. The causes includes sonic hedgehog mutation and trisomy 13, also known as the Patov syndrome. Uh, because the brain doesn't divide, so we usually get midline defects such as the cleft lip and cleft palate, and also cyclopia in severe cases. So whenever there's a defect with the brain and also associated facial defect together, you need to think about holoprosencephaly. Lissencephaly is due to failure of neuronal migration. In this condition, neurons don't reach the correct place where they have to be at. So the result is usually smooth brain. There are no gyri or no sulci. So this is called lissencephaly, literally meaning smooth brain. This results from abnormal neuronal migration during cortical development. So both these disorders, holoprosencephaly and lissencephaly, both of these disorders, both are developmental disorders, but the main thing that differs between them is the mechanism. In holoprosencephaly, there is a problem in the division, whereas in lissencephaly, there is a problem with the migration of the neurons. Whenever there's failure of the forebrain to divide into two hemispheres, it's called as holoprosencephaly. Whenever there's failure of neuronal migration leading to a smooth brain with absent sulci and absent gyri, this is called as lissencephaly. So now let's try to understand about few posterior fossa malformations. So the first thing is the Chiari 1 malformation. So this involves herniation of cerebellar tonsils only. Herniation of cerebellar tonsils only. It usually presents later during late adolescence or adulthood. Symptoms of this could include headache that worsens with cough and also ataxia. It's associated with a condition called syringomelia where there's a cyst in the spinal cord. So we can see in the image that there's downward herniation of the cerebellar tonsils through foramen magnum. And on sagittal MRI, so whenever there's questions asked with imaging, so you need to identify few posterior fossa malformations, and Chiari 1 is usually very highly tested on the USMLE. Fluid-filled cavity, there's a fluid-filled cavity or syrinx within the spinal cord, often due to altered CSF flow from cerebellar tonsil herniation. So this condition is called as syringomelia, and syringomelia is the most common association that we see with Chiari 1 malformations. Now, coming to Chiari to malformations, it is the most severe form of posterior fossa malformation. Here, there's herniation of the vermis, cerebellar tonsils, and also medulla oblongata. This leads to obstruction of CSF flow, which could eventually lead to hydrocephalus. More characteristically, it's non-communicating hydrocephalus. A very important association of the Chiari-2 malformation is the myelomeningocele. So whenever we see this combination, we need to diagnose it as Chiari-2 malformation. One more important thing to discuss about posterior fossa malformations is the Dandy-Walker malformation. So this involves absence of the cerebellar vermis. Other characteristic features includes cystic dilation of the fourth ventricle and an enlarged posterior fossa. This could lead to characteristic hydrocephalus again. So we have discussed Chiari-2 is also associated with hydrocephalus. In the same way, there's association of hydrocephalus with the Dandy-Walker malformation. So whenever there's big posterior fossa, whenever there's an enlarged posterior fossa along with a cystic dilation or cystic dilation of the fourth ventricle or a cyst, you need to call it a Dandy-Walker malformation. So there is agenesis of the cerebellar vermis, cystic dilation of the fourth ventricle, and enlarged posterior fossa. And the characteristic imaging would look like this in Dandy-Walker malformation. There is an enlarged posterior fossa. Now let's try to quickly differentiate all these posterior fossa malformations. Chiari 1 is associated with herniation of the cerebellar tonsils only. Chiari 2 is associated with herniation of cerebellar tonsils, cerebellar vermis, and also medulla oblongata. Dandy-Walker malformation is associated with absence of the cerebellar vermis. There is agenesis of cerebellar vermis along with an enlarged posterior fossa and cystic dilation of the fourth ventricle. So the diagram would look like this. Tonsils herniates through the foramen magnum in Chiari 1. Tonsils, vermis, and medulla herniates through the foramen magnum in Chiari 2. And in Dandy-Walker malformation, there is enlarged posterior fossa with cystic dilation of the fourth ventricle. Uh, Chiari 1 is associated with mild descent. It is often asymptomatic and is associated with a condition called as syringomyelia, where there's a cyst within the spinal cord. Uh, Whereas this Chiari-2 malformation is associated with severe descent, associated with a condition called as Spina Bifida, and also associated with myelomeningocele. Whereas Dandy-Walker malformation, there is cystic dilation of the fourth ventricle and enlarged posterior fossa. It is associated with hydrocephalus. So Dandy-Walker malformation, vermis is absent, and there's enlarged fourth ventricle. Now let's just try to revise everything, whatever we have learned about in this module. So let's connect everything. So neural tube defects, there is failure of the neural tube closure. Common conditions could be spina bifida, anencephaly, and encephalocele. Folate deficiency is the most important cause of these neural tube defects. So that's the reason why we prescribe preconceptional folic acid supplementation to prevent neural tube defects. Markers like alpha-fetoprotein and acetylcholinesterase can be used as diagnostic markers. AFP is a more like a sensitive marker, whereas acetylcholinesterase is more like a specific marker, and this acetylcholinesterase is used for confirmation of the screened neural tube defects. Brain malformations are associated with developmental defects. So, holoprosencephaly and lysencephaly are few brain malformations that we have discussed in this video. And also coming to the posterior fossa malformations, these could lead to CSF obstruction. So, Chiari 1, Chiari 2, and Dandy-Walker malformations are few of them. Chiari 2 and Dandy-Walker are associated with hydrocephalus. This leads to increased intracranial pressure. I hope this video helped you. Do subscribe for upcoming videos of our neurology series. In the next video, we'll be discussing about cerebrovascular disease. Thank you so much. Bye.